Hello, and thank you for joining us today for our UMMS COVID-19 community webinar. We value your time during this public health crisis. As we respond to the COVID-19 pandemic, UMMS is hosting these webinars to ensure that our communities are fully up to date on our forward stance against the virus, as well as steps that you can take to combat COVID-19 in your daily lives. Today's speaker will be Donna Jacobs, Senior Vice President of Government, Regulatory Affairs, and Community Health. Donna has a long career of service in Maryland, dedicated to healthcare policy issues, and has played a critical role in our COVID-19 response, coordinating community health programs and developing outreach strategies related to mental health. Today we will be addressing several topics, including evaluating COVID-19 risks. What steps can you and your family take to stay healthy this summer? Second topic, caring for our communities. Learn more about the importance of seeking timely medical treatment and the steps UMMS is taking to continue to deliver high quality and safe patient care. Third topic, resources to keep you safe. And we're also going to answer some of your questions from our last webinar. But first, I'd like to give Donna the floor to make some opening remarks. Donna?
Good afternoon. Thank you, Chris, for that kind introduction, and thank you to everyone joining us this afternoon on this call. It is indeed an honor to speak with you and to share with you some actionable tips for your day-to-day lives as we continue to confront COVID-19. We're at a point now where our communities are without question currently confronting two profound and significant crises: the global pandemic that substantially disrupted our lives in an unprecedented way, and the tragic, senseless death of George Floyd that has brought long-standing inequities in our country fully into the light and painfully to the forefront of the minds of so many across this nation. Dr. Mohan Santha, the president of the University of Maryland Medical System, recently sent out a poignant email to all UMMS employees, and I'd like to share some of his sentiments reflected in that message with you. Dr. Santha wrote the following to UMMS staff: "The complete lack of human dignity that is seen on the video images has once again shocked our collective consciousness and serves as a clear demonstration of the inequity that exists within our nation. As a singular voice, we must be willing to stand up and deliver the clear message that this cannot be tolerated. We can no longer let the deaths of Black men and women like George Floyd, Breonna Taylor, and Ahmaud Arbery occur, and then respond by hoping this is the last time we'll see such lack of humanity. We need to speak their names and continue to be purposeful in our conversations and expectations for those who we are privileged to lead." This, I'll tell you, is an expression of the beliefs of the leadership of the University of Maryland Medical System. I personally could not agree more, and I'm proud to know so many feel compelled to act. UMMS is committed to being part of a positive change by continuing to uphold the values of respect and dignity for those we are privileged to serve, and by committing to hold each other accountable. As friends, neighbors, and community members, we share in the desire that every person, is treated fairly. I would be remiss if I did not address the overlay of COVID-19 at the same time that so many in our nation are protesting. So many in our communities are gathering to stand up for justice, and for them, simply staying at home, as we've been told, is not an option right now. The protests and COVID-19 together present great opportunity for us to move forward, and they present additional challenges as well. As healthcare providers, we are incredibly concerned about the continued spread of COVID-19 And to that end, we must continue to take care of each other as the peaceful protests wage on. That includes taking measures to prevent the spread, of COVID-19. So if you're engaging in your community, we urge you to take the following precautions, the same ones we've been talking about for a while. Wear a mask when around others, even when you're outdoors, as wearing a mask lowers the risk of you spreading the virus to someone else. You could be carrying the virus and not realize it, as you may simply not have symptoms. Try to maintain social distances, physical distances, that is, of at least 6 feet from one another. And be mindful of how you're feeling day to day. Self-quarantine. Remove yourself from company of others if you're experiencing any symptoms of COVID-19, and that would include fever, shortness of breath, cough, fatigue, headache, muscle or body aches, or the loss of taste or smell. Summer and warm weather are upon us, and the precautionary measures we've taken to prevent the spread of COVID-19 thus far have become more and more difficult to continue. Many of us are experiencing what the experts are calling COVID-19 fatigue, and that's simply the feeling of being just plain tired of COVID and wanting to spend more time with family and friends and engaging, of course, in summer activities. We have to resist the desire to let up and to relax our practices. The things that we need to maintain throughout this summer, even as Maryland continues on the road to recovery, are the things I've mentioned just a moment ago. And that's as we're trying to return to, quote unquote, business as normal, as pools open and as parks open up. While some have speculated that the warm weather could help reduce the spread of COVID-19, the National Institutes of Health, which we look to for the expertise in this arena, has recently shared that that may not be the case. Many researchers really have their doubts that COVID-19 will enter a summertime lull. And as Governor Hogan has said, low risk is not the same as no risk, so we need to continue to take precautions. And that means that you should, again, continue the same preventive measures that most of us have already adopted to protect yourself and your family. These are what we know to be the best tools in our arsenal to combat COVID-19. And again, 6 feet distance, wearing a mask in public places like grocery stores, pharmacies, and other indoor locations, continuing to practice good hand hygiene by washing your hands often with soap and water, and when not available, using a hand sanitizer with 70% alcohol. Practice cough and sneeze etiquette. That's covering your nose and mouth with a tissue if you need to sneeze or cough, and disposing of that immediately. Remember that outdoor activity is safer than indoor activity, but take care when around crowds or large gatherings at parks or swimming pools and beaches. If you do choose to travel over this summer, as most of us ordinarily would, be aware of the local rules and the local restrictions. They may differ state to state and even within state and within various in-state jurisdictions. Our summer traditions and activities clearly will look a lot different this year than they have in past years, but take it as an opportunity to be creative and find new ways to adapt. Throughout this crisis, UMMS has not only remained open for care, and we can't stress that enough, we've also advanced new ways to continue to serve you and provide your healthcare needs well. Importantly, one of these is the significant expansion of our telehealth care services. Telehealth allows patients to interact electronically and by phone directly with their healthcare providers from home. Over the past 3 months that we've been dealing with COVID, we've worked hard to put together a high-intensity infrastructure to significantly expand the telehealth services that we can offer. We're proud to be able to offer these services to tens of thousands of Marylanders in order to meet their healthcare needs while giving patients flexibility and peace of mind by being able to stay in contact with their medical providers from the convenience of their own homes. Let me emphasize for you that UMMS and all of our hospitals are safe places for medical care. There are strict cleaning and screening protocols in place for you to ensure that your care is safe, even in the time of COVID, even while the COVID virus is still circulating in our community. This is incredibly important because too many Marylanders are delaying care, and some are even becoming seriously ill because that care has been delayed and because they've put off doctor visits or other health care due to fear of COVID. If you delay a treatment for a minor medical problem now, it could unnecessarily turn into a major medical problem later. So please don't delay any care that you think may be necessary. It's also critical that you do not avoid medical care for your children or delay vaccinations out of concern for COVID-19. Childhood vaccinations are an important part of preventing more serious diseases. You know your body and you know your health. Don't be afraid to call your physician or come to the emergency department if you believe something is wrong. There's also much information circulating about the prevention and spread of COVID-19 virus. We want to be a resource for you and a place where you know you can find trusted, reliable, current information on the COVID-19 virus. UMMS has established a dedicated website on COVID-19 that can be found at umms.org/COVID that you can see there on the screen. Our website has an incredible number of resources, including tips on prevention of COVID-19, treating the illness at home, and general suggestions on managing your health and wellness. The website even covers topics like coping with financial stress, and we know many people are under stress now, with many having lost their jobs during this period, and it provides links and phone numbers to connect you with various resources, including crisis hotlines for domestic abuse and more. UMMS also has a free nurse call line. The number's there on your screen, and it's staffed by registered nurses 24 hours a day, 7 days a week. You can call to discuss concerns or possible symptoms, and that number you see is 1-888-713-0711. During this exceptionally stressful time with both COVID, as I've mentioned, and the considerations of the inequities and injustices that many in this country are experiencing, it's just as important that you care for your mental health as it is that you care for your physical health. UMMS has hosted additional community webinars through our Not All Wounds Are Visible community conversation series, focused on having open conversation regarding mental health and COVID-19. These webinars have covered topics such as how to manage your stress, helping children cope with COVID-19, and how to stay connected while social distancing. All of these prior webinars can be found on the website at umms.org/notallwounds. We will, in the next couple of weeks, be hosting another mini mental health series on the current justice, race, racism, and associated trauma in this COVID-19 era on June 16th and June 18th. On the 16th, we'll be talking about adults and coping, and on the 18th, we'll talk about how adults can help children and other family members. Information about that mini-series will be available to anyone on this call who is already on our email list. So if you've gotten a notice about today from email, you should receive that. Or you can go next week to the Not All Wounds site or the umms.org/COVID website to get more information and to get the information to log on. We hope that you'll join us. These sessions are designed for the whole community and not just certain segments of it. It's really for everyone. You can also find updated information that's accurate and up to the minute from the Maryland Department of Health by visiting coronavirus.maryland.gov. As well, the Centers for Disease Control and Prevention has cdc.gov/coronavirus. There's a wealth of information on that site should you need it. And as Chris mentioned at the top, you can also ask questions during this webinar using the chat feature to the right. We want to help. Please reach out. We want to be able to answer your questions.
Thank you very much, Donna. Donna will now be answering some of the questions that you have submitted from previous webinars. As a reminder, please continue to submit any questions, as Donna just said, using the chat box on the right side of your computer screen. Donna, first question. What phase of recovery is the state of Maryland in, and what does that mean?
It's a good question. So Governor Hogan has set forth a gradual and safe path for us to reopen the state, essentially, and it's called Maryland Strong Roadmap to Recovery. It's a multi-phased recovery plan that has 4 building blocks, and they are expanded COVID-19 testing, increased surge capacity to be able to treat our sickest patients in hospitals, increase and maintaining an increased supply of personal protective equipment, or PPE, which is a term many of you may have heard, and a robust contact tracing operation, which enables the state to find people that may have come in contact with someone who's tested positive for COVID. So the state's established a series of metrics and goals that have to be met before we move from phase to phase. We've been in phase 1, and this week, Governor Hogan announced that as of 5 o'clock today, we'll begin to enter phase 2 of his multi-phase plan. The state has determined that we've reached sufficient numbers in terms of the positivity rate, which is a percentage of the positive results from the numbers screened, that it's dropped to single digits, and that the total number of current hospitalization has fallen to its lowest level in 7 weeks. So as of this evening, at the state level, we'll begin to enter stage 2, phase 2, which includes lifting of the order that closed and non-essential businesses and retail shops and bank branches, autos, showrooms, nail salons, and a list of other specialty vendors and businesses can now reopen, albeit at a reduced capacity in many instances. Individual counties and Baltimore City still have the authority, as the governor has said, to determine the extent to which they will fully move into the next phase and to set any particular guidelines with regard to that. The state is still maintaining, however, the 10-person maximum limit for all gatherings.
Thanks, Donna. Next question. What is contact tracing, and what should I do if I am contacted by a contact tracer?
All right, well, I began to mention this just a minute. Contact tracing is a really important part of us being able to move forward as a state and to reopen. And the idea is that it will help us reduce the spread of COVID-19. And it simply says that we're contacting people whom we know have tested positive for COVID-19 in the prior days or weeks before that confirmed diagnosis. And those that people have been in contact with are asked to take protective measures, such as self-isolating, taking yourself out of circulation, and monitoring symptoms so that we can slow or stop the spread of the disease. It's important to know that if you get a call from a state contact tracer, the caller ID will read MD, Maryland, COVID. Baltimore City is soon going to have a team of its own contact tracers, and the information coming from them may be different. Many people have expressed concerns about being contacted by someone who identifies themselves as a contact tracer, which is why I give you this information. And you should know that a contact tracer will never ask about your health other than COVID symptoms. They'll never ask for financial information or personal details unrelated to COVID-19, nor will they ask for your Social Security number or bank account or any other financial information or for payment. So you needn't worry about that. You can always ask for ID. Contact tracers are required to take extreme measures to protect the privacy of any person that they contact that they know has been infected with COVID-19, and to follow any privacy rules and regulations that are set by the government. And it's really, really, really important that if you are contacted by one of these tracers, that you do listen to the information that they want to provide and follow their instructions for your safety and for the safety of others in our community.
Thank you, Donna. Next question. Are there testing sites that do not require a doctor's referral?
That's a great question, and the answer to that question has evolved over time. As many may know, at the beginning, you had to have a doctor's referral to be seen at a testing site. These testing sites are, again, one of the other really important building blocks in our master road to recovery. And the state has expanded testing by 117% over the month of April. That will be the case by the end of this week. We'll also have about 400,000 tests that have been completed. And as the capacity for testing expands, people with coronavirus symptoms, and in other cases those without, can be tested now for active COVID disease. At one point, it was only those who were hospitalized, then only those with symptoms, and then healthcare providers, etc. But now testing is being open to many more. Indeed, at this point, there are about 100 testing sites in Maryland, and they offer a different range of options. Some require a doctor's referral, as the question notes, and others do not. Some require appointments. Some are drive-through facilities only, such as the VEEP, the vehicle emission testing sites around the state, and some are walk-up, and there are some in Baltimore that I can think of that are walk-up. So since there are so many, I would direct anyone who is interested to get more information about these testing sites and the various requirements at sites, or even where the sites are located, by visiting the UMMS website at ums.org/coronavirus/test. And you can find the specifics that you may need for your local jurisdiction.
Thanks, Donna. Next question. Is it safe to swim, even socially distanced?
That's a great question, and really important as the temperatures start to hit 90 degrees. So swimming in a pool, in a chlorine pool itself, is likely to be of very little risk. A community pool may be a little bit different in that there are many gathering sites and activities that may happen around the pool, so that begins to create a higher level of risk. The same could be said about the beach. Swimming alone at the beach is probably fine. It's the gathering and the socialization that may happen within 6 feet that begin to create problems. So just be mindful of that. I don't know that anyone would say never go to the beach or never go to the pool, but keep these risks in mind as it's important that you reduce the risk for yourself, again, and for your community.
Thanks, Donna. Next question. Should I wear a mask outdoors if I'm taking a walk, running, or riding a bike?
Well, the rule of thumb that people may not want to hear is it's best to always wear a mask whenever it is possible, even outside, and especially if you're walking along and it's a crowded area and you cannot keep socially distanced. Masking and maintaining social distances is key to prevention. Again, it's one of the best measures we know of to keep ourselves safe. And this helps reduce the transmission from you to another, and to some degree may help a little bit with you actually contracting the virus. COVID-19 can be transmitted through airborne droplets, and the CDC believes that the aerosol emission during speech, normal speech, is problematic, of course, but that it also is further correlated with how loudly you're speaking. So the more volume in your voice, the more likely you are spewing out air droplets. And it's important to note that same concept carries over as well for singing and shouting, and it's believed that those also further contribute to the greater transmission of the coronavirus.
Donna, do you want to address the messages of gratitude for our healthcare heroes?
Oh, sure. So many of us have asked from time to time, what can we do for our frontline workers who've been so hard at work, keeping us safe, doing the best that they can, and working round the clock in many instances. And the best way, I would say almost universally, is for you to simply help reduce the spread of this disease so we can get past this disease as quickly as possible by continuing to socially distance, by hand washing, and the other common sense measures that we've spoken about today. If you would like to leave a message of gratitude, and many people have for our employees, I would encourage you to do so by leaving a message on our digital bulletin boards at the address that is displayed there on the screen. These messages do encourage our staff. We get their thoughts and notes of appreciation all the time, and they help keep our families and communities safe and healthy. Thank you all again for joining us today. We hope that this information is useful to you and that you've received some tools and content that's helpful to you and that helps you maintain a safe distance against the COVID-19 virus and to keep yourselves healthy.
Donna, thank you very much for the great presentation, and thanks to all of you for joining us today. We hope that you will stay connected. You can find our social media channels displayed on the screen, and we hope that you will sign up for emails at ums.org/email. Also wanted to just remind you of a couple things. One, our UMMS COVID-19 response website is open to everyone in the community, and we encourage you to visit. It's ums.org/COVID, COVID. And then we also have our nurse call line, which again is designed specifically for the community. That number is 1-888-713-0711. We are grateful for everything you are doing to keep yourself, your loved ones, and your community safe. Thanks again for joining us, and have a great weekend.